There were no jobs, so I worked at a department store selling jewelry, and I took whatever job I could get, and I also interned for no pay wherever I could get it. And those experiences were really valuable because not only did I find out what I wanted to do, I absolutely found out what I did not want to do. And that was really, really important. The other thing that the other panelists mentioned as well is committee work. If you can be involved in any types of committees that will help you not only to make connections and network with people, but also to develop some leadership skills and teamwork skills, those are really helpful. I would just say, now, I wish I appreciated how important networking was when I was looking, just starting out, and it really is incredibly important.
Relationships are key in every aspect of our lives. They're extremely important when you're looking for your next job. So remember to stay connected with people and to write thank you notes and to call people instead of emailing them. As a communications major, picking up the phone means so much more than emailing somebody in any type of communication. So just remember that just because you have the job you want doesn't mean you have to forget everybody you ever worked with or who helped you get that job. And don't be afraid to ever say to somebody, can I help you, and then actually do what you say you're going to do. So make the phone call that you promised you'd make for them.
Your foot in the door is that you already work there. And so you can go through those listings and say, that looks interesting, that looks interesting. Make that list and start contacting people. As far as research is concerned, it's all housed under one group called the Center for Clinical Investigation. My current boss knows my old boss. And so not just getting a referral from them to say, oh yeah, he's a great worker, it was I knew that they were going to have coffee and sit down and say, what does he know? And is he going to be effective?
I was fortunate enough to have a school with co-op, but really my initial job came out of the volunteering I was doing in college. So, and the point made earlier about keeping good connections, even if there's, maybe not the best way in which you leave work sometimes, is really critical. The world is incredibly small when you get to the arenas that you're interested in. But I want to respond to this from the point of view of somebody that's employed hundreds and fired, maybe not hundreds, but a lot of people over time. And I want to say that don't diminish the importance of, and the usefulness of a job that's in a place where you want to be, but it's not a job you want to do. A good boss, and I like to think that I was one, will see your skills and help to facilitate you out of the executive assistant or predominantly secretarial role. So sometimes the foot in the door really is being in the place where you can show what you know. Once you have that foot in the door, you want to show what you know. So don't just do the job as the job is laid out to you, but think about how you bring added value. I mean, this is an exciting and a complicated time to be answering that question because the changes in terms of healthcare coverage that are occurring in the Affordable Care Act are bringing a range of preventive and habilitative services and rehabilitative services under payment mechanisms that they weren't previously under. So there have been roles that public health has played that now there will be payment mechanisms for. So some of those jobs may be at the intersection of the evolving accountable care organizations and all. But in terms of allied health and my experience in public health and the ways in which we used it, a major one was, first of all, early intervention related stuff that occurs in the home, is focused on a mix of the family and the kid with, born late, certain disabilities, certain level of dysfunction. And that's going to continue to live in two worlds because it's both very much going to be a covered service and is in many insurances right now, but it's also, in terms of the public health world, about prevention, of future and more expanded disability. Public health historically has continued to run what they call public hospitals, but essentially places where complex individuals who are not easily cared for in other environments and or are custodial or wards of the state. They're complicated places. One of them is the Shattuck, if any of you have ever been there. Among the population served there are people in the corrections arena. So while this is a healthcare arena, public health comes in to kind of wrap around what healthcare does or doesn't do. Very, critically important area. There's a lot of habilitative stuff that I hope will be paid for in the future, but that's been associated with post-injury, post-trauma, improvements in functioning, people with brain injury, etc., that the allied health sciences have been very important to in interacting within public health. And then there's the larger environment stuff. Allied health services, including PT, have been really important in thinking about environment and the accommodations of it and the accessibility of it and how that facilitates people's access to services or diminishes their risk.
Thinking about your comfortability and going into someone's home to provide services rather than being surrounded by a hospital setting or a nursing facility setting. So looking at that within yourself, how comfortable are you providing services in that setting? And also just looking at alternative settings for medical. I worked in a medical respite facility for the homeless, and that's, within even the country, it was a very unique model of health, of providing health services. So just looking at out of the box, and we're definitely making big strides, thank goodness, in how we're funding allied services, but there's more improvements being made because of the populations that we're serving and where they're living or not living.
I think it kind of depends, but I think the skill set that you're bringing can go into a lot of these environments. I mean, there are many of the public health delivery entities are either public or nonprofit. They, generally speaking, have suffered from a lack or insufficiency of infrastructure to manage, resource allocation adequately, et cetera, et cetera. So there's a lot of, and they're being forced to, professionalize all that more now. So there is a lot of potential opportunities there. But I personally am really glad. I would have wasted graduate school if I had gone early. That's not a comment on anybody else. It's just, it wouldn't have worked for me.
I felt I had an advantage over many of the other students who didn't have professional experience, so it worked for me to go later. And I would also say, we need people with business sense in public health.
Absolutely.
Because I don't have any, so I really rely on, I appreciate people who have that skill set. So if you think that's something you might want to go into, it might be worth trying it for a while.